Hi, good morning. This is Linda Cowles, and I'm bringing you a seminar from the Elise Tomlin Community Center on this Monday, March the 8th, 2021, on health and wellness. Health and wellness, and we have a guest speaker today, Ms. Shana Keo, and she is from the Community Health Center here in Groveland, Florida. She's going to be talking to you today about the services that are available to the underinsured and what you can achieve by visiting their centers. I'm going to call Ms. Sheena up and she will begin her session.
Hello, everyone. My name is Shana, and I'm with Community Health Centers. So today I'm going to tell you a little bit about who we are, where we're located, who we serve, who can benefit, and the insurances we accept in our sliding scale discount program. So to begin, Community Health Center's mission is to give quality and compassionate primary healthcare services to Central Florida's diverse communities. Just to be clear, we have no affiliation with the health department. Sometimes people get a little bit confused with health center and health department, but there is no affiliation there. For a little bit of history about Community Health Centers, we were founded in December of 1972 in Apopka, Florida. We began under the operation of 4 nuns from Notre Dame, and we were originally called the West Orange Farm Worker Health Association. The original mission to this organization was to provide the underserved in the community access to healthcare they couldn't afford. And our original staff in that single wide trailer included just a nurse's aide, a medical director, and an administrative director. We've come a long way since those single wide trailer and limited staff days, and we now have 12 centers across Lake and Orange counties. Our Orange County offices are located in Apopka, Bithlo, Forest City, Lake Eleanor, Meadowwoods, Pine Hills, and Winter Garden. And our Lake County offices are located in Tavares, Leesburg, Groveland, Claremont, and Four Corners. Our administrative offices are located in Winter Garden, since that's the most centrally local place to all of our centers. We serve absolutely everyone, regardless of insurance status and regardless of inability to pay. A common misconception to people, because our mission is to serve the underserved, is that you have to meet some sort of qualification in order to come to us of being underserved, and that's not true. So you can be fully insured or not insured at all, have limited insurance, everyone in between, and we serve everyone. We do have state-of-the-art centers, doctors, and equipment. That could be another misconception based on our mission to serve underserved, but our centers are absolutely beautiful. We have top of the line equipment, and our doctors are passionate about what they do in helping the community. Although CHC does target the underserved population, everyone can benefit. We have a little bit more benefits to the underserved community naturally, such as bus passes. So if we have a patient that calls us to make an appointment and says, I don't have a means of transportation to get to and from my appointment, we will actually provide a bus pass for you to get to and from your appointment promptly. One of my personal favorite aspects of Community Health Centers is our pharmacy. And with our pharmacy, because we're a federally qualified health center, we are able to get medications at a lower cost, which in turn allows us to give them to our patients at a lower cost. And that's not just prescribed medications. We also have Advil, ibuprofen, and Tylenol, and those all come at a lower cost again to our pharmacy. So if you are a patient with us, you have access to our pharmacy, and those medications will come cheaper to you than the otherwise Walgreens, CVS, Target, or Walmart shelf. We are a one-stop shop, meaning we have multiple services at all of our centers. And just to be clear, on the back of our brochures right here, it'll tell you all of the centers that we have at each one of our centers. And there's a little diagram here with all of the pictures that you can figure out which services are at what center. You can also get onto our website at www.chcfl.org to find out more information about what services we offer at each center. Those services that we offer include family medicine, internal medicine, OBGYN, pediatrics, dentistry, optometry, behavioral health, and since COVID started, we also offer services via telehealth. We also provide case management, family planning, labs, x ray, and pharmacy. Lastly, for the insurances we accept in our sliding scale discount, we accept almost every insurance under the sun with the exception of Blue Cross Blue Shield. And our sliding scale discount is a program based on household income and size. So, one of the things that's cool about our sliding scale discount is that if you come to us and you say, I really need help affording everything, we give you whenever you call to make an appointment, we'll give you a list of things to do in order to get on our sliding scale discount. And the Anointed Community Services will actually sign the letters that will bring you into our sliding scale discount program, which is renewed every 9 months. It's renewed every 9 months. We hope within a 9-month period, something's changed in your life financially, whether that's getting a raise or getting a job or getting some form of income to help you out a little bit more. But this sliding scale discount basically gives you credits that are applied to your insurance deductibles. And an example I can give to you so you kind of understand how helpful this can be is with our optometry department. So for anybody who wears glasses and gets annual exams knows that without insurance, the cost of that annual exam and the glasses is absolutely outrageous. Using our sliding scale discount, assuming you have no insurance, with the applied credits that you can get, it brings those out-of-pocket costs down tremendously, which is a huge help to our patients. In closing, CHC is a huge resource to our community, and I hope everyone has enjoyed getting to know a little bit more about us. I would like to open this up for questions, and I just want to remind everyone that if you need a refresher on anything, we do have our little pamphlets here that have a lot of information about us, and also on www.chcfl.org is our website, and you can find tons of information on there.
Questions? Okay. Thank you so much, Sheena. Back to women's health. Since we are broadcasting this out to our women, right. Can you tell us what is available in the Groveland Center for women and children?
So for our Groveland Center, let's see here, we do have pediatrics. We don't have OBGYN, but gynecology services are offered at our Leesburg office, which is the closest office we really have to Groveland. And we also do the case management and family planning for you. So whenever we do have women and children, if you're pregnant, we have a partnership with Advent Health where that's where you would deliver your baby. And we also have a lot of information and other little folders of pamphlets and stuff for you, just information to know right before your child comes into this world. And we'll give baby backpacks for diapers and everything too to help out with the costs of bringing a child into the world.
Okay. Also, dental is included in that scale?
Yes, ma'am. So dental is included. Unfortunately, right now, we are at capacity where we serve all our adult dental patients, which is Groveland, Lake Eleanor, and Apopka. But for pediatrics, we will always make room for our pediatric children. The health of our dental area is extremely important to take care of from a young age. So we do always find room to make sure we can take care of pediatric patients.
Okay. What about eye optometrists, eye service to get eyeglasses and our seniors and all of population?
Absolutely. So our optometry offices are located in Winter Garden, Pine Hills, Leesburg, Four Corners, and Forest City. And at all of those, we have a wide selection of glasses that you can choose from. Again, we have state-of-the-art equipment to be able to do your annual exam and everything. And that is part of our sliding scale discount program. So that makes it really helpful to everyone there with that. And like I was saying, it does bring those out of pocket costs down tremendously in the optometry, really in all the areas. But optometry is kind of one of those that I feel like really can give you a good idea of how much you would actually be spending. And
Any other questions?
And this is, even though we are specifically targeting women,
mhm.
but it's for men and women.
Right. We serve everyone in the community. There's no qualifications that you have to meet with age or anything because we do women and babies. We also will serve newborns and
Men as well.
with our pediatrics. Yeah. So you just have to kind of look at our flyers or on our website and just find out what offices you need to go to for the service that you're looking for. Because again, although we offer all these services, every single service is not at every single center that we have.
Okay.
And is there any days that you're closed?
So we are closed on we have extended hours. So on Mondays, we're from 8 to 6. On Tuesdays, we're 8 to 7. On Wednesday and Thursdays, we're 8 to 5. And our centers on Fridays close at 1 o'clock. I'd have to double check on the website, but again, everyone can look on that website. We have a couple of centers that do some hours on Saturdays. I'm not 100% which centers those are off the top of my head right now, though.
Okay. And can you just reiterate what about the sliding scale and the ability for our center here to sign off on those that are underinsured?
Yeah, absolutely. So whenever you want to get on our sliding scale discount, what you do is you're going to call the number on the back of this pamphlet that's actually also in our website. So the one that ends in 8827 is more of our Orange County, and the one that ends in 7400 is more of our Lake County one. But so whenever you call, you're going to become a patient with us and you'll express that you want to get on our sliding scale discount. And whenever you talk to someone creating your appointment, they'll let you know what documentations you need. You can also find those documentations you need on our website. And from there, they'll let you know the closest area you can come to, including the Anointed Community Services. And they will be able to sign off on the letter every 9 months that you have to renew to say, yes, this person needs help and they qualify. And from there, you'll turn in that letter to us. And then you'll be on our sliding scale discount for the 9-month period until you have to get that renewed or you don't.
What's your website?
And our website
We're
is www.chcfl.org, and that stands for Community Health Centers Florida.
Okay, wonderful. And if you'll just reiterate your name again, your position there. And
Yeah. And again, my name is Shayna Keogh. I'm a community event specialist for Community Health Centers.
Okay. Thank you, Shayna.
Thank you.
Thank you so much. Thank you. Okay. So we are so happy to have Shayna Keogh here with us from the Community Health Centers. And we want to wish all of our women a happy International Women's Day. This is International Women's Day, and this is Women's Month. The month of March is the month that we celebrate women. Women and children is our part of our mission here at Anointed Community Services. And although the services at the community health centers are not just for women, they're for men, they're for seniors, they're for children. And we will be giving you the website again so that you can go onto this website and see the different locations and the different services that they're offering. And the Lake County number for the Community Health Center is 352-314-7400. The number for the Orange County is 407-905-8827. So again, we want to wish all of our women a happy International Women's Day, and also to bring to you more sessions on women's health. During COVID-19, women suffered the most, I do believe, with their health because of the fact that they're caregivers, and the women are the ones caring for the husbands, caring for the children, caring for the disabled adult, and women need to take care of their health. So we'll be bringing these sessions to you so you can learn how to take care of your health, and so that we can keep you here longer. Because when women are empowered, the whole community is empowered and the nation is empowered. So thank you for joining us, and stay tuned for more sessions on women's health and what they can do to better their health. And we're bringing this to you from Anointed Community Services International right here at the Elise Tomlin Community Center. Thank you so much, and stay tuned for our next session.